Yeah, so Anna and Carter, respectively, John Seymour had here at the ICML meeting presented now the long-term follow-up and the final analysis of the Murano study after 7 years. And the Murano study was done in relapsed CLL. Most of the patients had a first relapse, and patients were randomized between bendamustine and rituximab versus 24 cycles of venetoclax accompanied by rituximab during the first 6 cycles. The huge difference in progression-free survival, also in overall survival, and the data show that particularly patients with undetectable MRD benefit when they finish the 24 cycles of venetoclax plus rituximab. What was interesting about the abstract which was presented right now, that there was a sub-study in which patients from both arms could be included and retreated or crossing over from bendamustine rituximab to venetoclax rituximab, or retreated with venetoclax rituximab. And overall, there were 34 patients being included. The majority of them were from the previous Ven-R arm. So the study looked at like the sequence venetoclax rituximab and then retreating with venetoclax rituximab. And so most of these patients had some very unfavorable risk factors. If there was a high proportion of patients with TP53 aberration, for example, or complex karyotype, still the median PFS for the sub-study for retreatment is around 2 years, or a little bit less than 2 years. And most of the patients have achieved partial remission, but they were even with retreated a few patients who again had undetectable MRD rates. So therefore, I think this study is important because the question so far about retreatment with venetoclax plus CD20 antibody is open, and this is now in a prospective, these are first prospective data collected in the sub-study, and so yes, patients can be retreated with venetoclax rituximab also in an efficacious way.